Hi, this is Michael Jordan, President of our Labor and Strategic Accounts Division at MagnaCare, joining you today from our conference room in Tinton Falls. Today's topic is going to be on the preventive care services covered under the ACA. Now, for those of us who live in New York and New Jersey, we went through a lot of reform relative or specific to preventive care decades ago. We understood the importance of these programs in getting out in front of medical conditions, and therefore made it part of our fully insured programs. In a lot of ways was adopted on a lot of the self-funded programs years ago. But with the ACA in 2014, it brought upon national reform and putting preventive care at the forefront as something being mandatory as a covered benefit, unless obviously you're part of a grandfathered plan, because the value of preventive care, we understand, does have a long-term impact on the healthcare cost and the healthiness of a plan sponsor's population. These are covered as part of the minimum essential coverage mandate. There are over 60 plus preventive care services covered under the preventive care mandate. Today we're going to go over 4 changes or clarifications to what happened in 2016, as there were some updates for the preventive care covered services out there. First is colon cancer screening, which historically was something upon hitting age 50. Annually, testing was part of a prerequisite or forum. Going forward, we're actually out there, or the government came back out with a recommendation that every 10 years between ages 50 and 75 is when this testing should be part of the preventive care services and screening. Likewise, any pathology testing or reading must be covered as well, and any anesthesia. There was a hole in some of the coverages up until 2016 relative to anesthesia being covered as part of the colon cancer screening. The second thing I'd like to update you on is on prostate cancer screening and PSA testing. This service is no longer part of the mandated benefit, although if a covered plan sponsor's benefit does include this type of screening, a physician must sit with the member or the patient and go over the pros and cons. Again, the USPSTF, the United States Preventive Services Task Force, is really the governing body looking at a lot of these things. Third, genetic testing and BRCA testing. And BRCA, although on the surface stands for breast cancer screening, it actually does go way beyond that. And in essence, it's coverage for females, whether they've had a family history or a personal history of either breast cancer, ovarian cancer, tubal or peritoneal cancer. This would be a covered service. The last one is on transgendered individuals that are now eligible for screening of tests for residual genital tissue. Again, there are over 60 plus preventive care services covered under the task force information, and depending on the plan sponsor, the list can be divided up between A and B, but these are 4 of the more timely updates that happened in 2016. Thank you.